Have you been feeling not as strong as you used to lately? You're not alone. Millions of men over 50 are silently facing an uncomfortable truth: erectile dysfunction. But the real concern isn't just about difficulty getting hard or not lasting long enough. This could be your body's quiet warning that your heart is weakening, your blood vessels are clogging, or your testosterone is slowly depleting without you even knowing. Many people think erectile dysfunction is just a natural part of aging, something inevitable, just losing your manhood. But modern science has revealed it could be an early sign of diabetes, high blood pressure, cardiovascular disease, or even prostate cancer. Shocking? Yes, but it's a truth most men ignore until it's too late. Ask yourself, do you still wake up in the morning with natural erections like before? Have you felt a decrease in sexual desire without any obvious reason? Have you ever been unable to continue midway even though you still wanted to? If the answer is yes, then you shouldn't wait any longer. In today's video, we'll dive into the earliest signs your body is trying to warn you about, safe, private, and effective diagnosis and treatment methods, and the latest medical solutions helping millions of men regain their vitality, both physically and emotionally. Don't let embarrassment cost you your health. Watch until the end, because this could be the turning point that helps you reclaim yourself. If you've started to feel unsure, listen closely to what your body is trying to tell you. Erectile dysfunction doesn't happen suddenly. It always begins with small, silent signals, and if you're alert enough, you'll recognize them before things get worse. The most common early sign is difficulty maintaining an erection during sex. At first, it might just be a rare off moment, but gradually you'll notice you're losing control, even though the desire is still there. Next is the feeling that your erection isn't firm enough or doesn't last. Even if things start off well, you might lose the ability to continue, leaving both you and your partner frustrated and worried. Another undeniable sign is a significant drop in libido. It's not because you're too busy or stressed, you simply don't feel interested. Even the things that used to excite you no longer have any effect. And especially if you no longer experience morning erections like before, that's a strong warning that blood flow to your penis is compromised. Additionally, premature ejaculation or even difficulty ejaculating are also early warning signs. These often come with disappointment, anxiety, and prolonged tension every time you get intimate. And the psychological toll only makes things worse, creating a vicious cycle that's hard to break. Most importantly, if these signs occur frequently and persist for several weeks or months, it's no longer just a phase. It's time to seriously assess your condition, and don't wait until it's too late. In the next part, we'll explore when should you actually see a doctor, and why doing so early can change the entire quality of your life. You might still be wondering, do I really need to see a doctor, or should I just wait a little longer? This is a question many older men ask themselves, and unfortunately, too many wait far too long. If your symptoms have lasted more than 3 months, then it's no longer just a tired period or just age. Your body is clearly speaking up, and ignoring it means missing the window for simple and effective treatment. Especially if you feel mentally affected, lose confidence, or avoid intimacy with your partner due to shame, please don't stay silent. Erectile dysfunction doesn't just affect physical health. It quietly undermines family happiness, causing cracks in relationships you've built for a lifetime. Some men try folk remedies, over-the-counter pills, or make lifestyle changes like exercising or eating healthier. These are positive steps, but if you've tried them and nothing has improved, that's your cue to see a medical professional for a thorough evaluation. And if you have underlying health issues like diabetes, high blood pressure, high cholesterol, or heart disease, then early medical consultation is even more essential. You might feel embarrassed, ashamed, or afraid of being judged. But the truth is, millions of men are experiencing exactly what you are. Medical professionals have seen it all, and they're ready to listen, support you discreetly, respectfully, and professionally. Don't be afraid. Visiting a doctor not only improves your intimate life, it could protect you from serious diseases quietly progressing inside. Next, let's look at the actual diagnostic process, what it really involves, and why it's far less intimidating than you might think. Many men delay seeing a doctor simply because they're embarrassed. Embarrassed to speak about it, afraid of being judged, and most of all, afraid the examination might be awkward or complicated. In reality, it's nothing like that. When you visit a doctor with suspected erectile dysfunction, the first step is history taking and consultation. This is just a simple, private, and fully confidential conversation. The doctor will ask, "When did your symptoms begin? How much are they affecting your daily life and intimacy? Have you noticed changes in desire, emotions, or erection ability?" Next is a physical exam. The doctor will check your blood pressure, heart rate, hormone levels, and some physical reflexes to evaluate your overall reproductive and circulatory health. It's gentle, discreet, and painless. Then you may be asked to take a blood test. This is to measure testosterone levels, the male hormone that plays a crucial role in erectile function. Check your blood sugar and cholesterol to detect risks of diabetes or metabolic disorders, common causes of sexual weakness. In some cases, the doctor might recommend a penile ultrasound for deeper investigation. This is a non-invasive, painless procedure that assesses the blood flow to the penis, a key factor in sustaining an erection. The entire process is safe, fast, and completely confidential. You won't face anything close to the scary scenarios you might imagine. Remember, this is not a test of your manhood. It's a chance to reclaim your health, vitality, and confidence, something every man deserves. In the next section, we'll explore modern treatment options, from simple lifestyle changes to advanced medical interventions, helping millions of men make a powerful comeback. Once you've been accurately diagnosed, you can breathe easier, because here's the good news. Erectile dysfunction is entirely treatable. And today, there are many modern solutions tailored to your condition and physical health. First, lifestyle change is the foundation everyone should begin with. Things as simple as eating a healthy diet, exercising regularly, getting enough sleep, quitting smoking, and limiting alcohol can have a huge impact on sexual health. When your body is strong, your blood flows well, and your hormones are balanced, your sexual performance naturally improves. In many cases, psychological factors are the biggest obstacle. Anxiety, pressure, or shame from past failures can trap you in a mental loop. The more you worry, the worse it gets. In such situations, doctors may recommend therapy or counseling, either individually or as a couple, to help you overcome the mental block before treating the body. If the root cause is hormonal imbalance, especially low testosterone, you may be prescribed hormone replacement therapy, which could be administered via injections, gels, or pills, but always under close supervision. One of the most widely used treatments is PDE5 inhibitor medications, like Viagra, Cialis, or Levita. These drugs enhance blood flow to the penis, supporting the ability to achieve an erection when sexually stimulated. However, you should never self-medicate, as each drug has its own dosage, contraindications, and potential interactions. Medical guidance is essential. In severe cases where medication is no longer effective, doctors may recommend penile support devices, injections directly into the corpora cavernosa, or even penile implants, more complex but offering long-term results. Most importantly, you are not alone, and you don't have to suffer in silence. Modern medicine can help you regain your confidence physically, emotionally, and in your relationships. The final part of this video is a personal message for you, who might be silently facing a battle no one sees. You might be watching this video quietly, alone, wondering, can I really get back to how I used to be? Does anyone understand what I'm going through? Is it worth it to see a doctor, to start over at this age?
The answer is yes, 1,000 times yes. Because you still have the power to choose. You can still change. And more than anything, you deserve to live fully. Not just in your work, but also in the private, emotional moments with your life partner. Erectile dysfunction is not the end. It's a sign, a signal for you to pause, listen to your body, and begin a new chapter of health. Millions of men around the world have overcome it. Not because they're better than you, but because they had the courage to admit it, to take action, and most importantly, to seek medical help at the right time. If you found this video helpful, hit like, share it with someone you care about, because someone out there may need to hear this too. And don't forget to leave a comment below if you have questions or just want to share with others who understand. I believe that even a small step today can change